My name is Melanie Blanc, and I am a graduate, or I just graduated from the University of Wisconsin-Stevens Point as a speech-language pathologist. And we came down here as a group of, there's 15 of us students that came down to KFA to see the way that they treat children with cleft lip and palate, children and adults. In the United States, we don't have the same opportunities to see treatment of this sort. We learn about it in class and we see pictures in textbooks, but we don't get the hands-on experience. And so we came down here to see the way that it's treated, to see the interdisciplinary action of all the different professionals that are working together. And we wanted to see how we as speech-language pathologists work with the surgeons, work with the dentists and the pediatricians to treat all of the individuals with cleft lip and palate as a whole team, because it's involving so many different professionals. And as a speech-language pathologist in the United States, we work much more separately. And so we wanted to see it working together in one location as a large group that follows each individual all the way through the progression of the services that they need. So we came down just to observe, to learn from the people down here who have done it just so differently than we have in the United States. And as we have already, most of us have already taken the class in our graduate program, we have some of the basic understanding, but now we have the hands-on experience of seeing it and understanding it from just a real live perspective. And since I just graduated and I'm going to get a job in a hospital, hopefully I'll be able to work with this in my future career. I would love to have the opportunity to do this, so I hope to take this information and this experience and apply it to my job as a professional and to change the way that I'm treating, because now that I've seen it in this sense, it's different than what I've experienced in the United States, and hopefully we can take this experience and transfer it to our treatment in the United States.
My name is Allison. I'm coming from the University of Wisconsin, and we are studying speech-language pathology. I plan on working with all age groups and different deformities. Craniofacial deformities are of interest to me, and this visit has helped confirm interest in this area. And KFA has shown us a good example of teamwork for this between the different professions, and the unity between psychology and speech-language pathology and plastic surgery, pediatrics, and genetics. The model here is very unified. People are in a team together and supportive. The speech-language pathologist here makes a lot of decisions for the clients, determining type of therapy and the necessity of the therapy and surgery. This is different than in the United States slightly, and the example here has helped form my view for how to do better speech-language pathology and make informed decisions for clients with craniofacial anomalies and deformities. Other questions?
Qual o nível dela, né? Qual o nível dela? Ela é mais pós-graduação?
What's your graduation?
I graduate 1 year from now in May of 2011 with Masters in Speech-Language Pathology.
I'm Pam Terrell. I'm an assistant professor at the University of Wisconsin in Stevens Point, Wisconsin. I'm in the Department of Communicative Disorders, which is speech-language pathology, and I've also worked as a speech-language pathologist for 16 years. We're here at KFA in Curitiba, along with 15 students, 14 graduate students, and 1 undergraduate student from Wisconsin, here to observe and learn about interdisciplinary treatment of cleft lip and palate and craniofacial disorders. I came here last year with a grant to observe and consider the possibility of bringing students. I met 2 of the plastic surgeons 4 years ago during an Operation Smile mission in Nicaragua, and they were very instructive and such good teachers, and I heard such good things about their work at CAIFE from them and how much they loved it. And so I came to look and discuss the possibility of bringing students to learn as well. Our students take a class in cleft palate at the university, but we're in a largely rural area, and so they don't get to see many children with cleft lip and palate, because in the United States, most of those children go to bigger cities where they have cleft palate clinics. However, these students, once they are professionals and they are working, they will encounter children and even some adults with cleft lip and palate, and they usually have no experience and frequently have never even seen a real person with cleft lip and palate in the area where we are. So I thought this would be a good opportunity for them not only to get to see children with cleft lip and palate, but also to hear how they speak. And even though it's a different language, the speech sounds between English and Portuguese are very similar. The types of speech sound errors that children make are very similar. The voice problems and hypernasality that people with cleft lip or cleft palate have are very similar. And so they would be able to appreciate those differences. And also, this is the most cohesive, integrated team I've ever seen. Everyone works so well together. They consult each other, respect each other's opinions, and it's a very integrated team. So the students have come here to see this. They are learning so much. They're getting to see some syndromes that they've only read about in textbooks and that many people never get to see. They have been able to observe surgery. They're observing all the professionals, the ear, nose, and throat physicians, geneticists, psychologists, speech pathologists, plastic surgeons, orthodontists, dentists, prosthodontists, and oral maxillofacial surgeons, all working together. So this knowledge will help them when they go back to make what they've learned in class and in a textbook more meaningful to them. And at some point in the future, when they do have a child with a cleft lip or palate that they have to work with, they know a little bit more to do and what resources are out there. And I think another thing they're learning is that no one ever knows everything, that it's a constant learning process, and that's what the professionals here do. When they get someone maybe with a syndrome that they've never seen before, they don't turn that patient away. They contact someone else they know and start discussing and figuring out, have you seen someone like this? What did you do? How can we do it? And it's just really a worldwide community of professionals interacting together. So they're very excited about what they're seeing. It's even better than I imagined last year when I came with the dream to bring students here for the experience they're having. All the professionals here are such good teachers. They're very patient. They're taking time to explain to my students what they're doing with the patients and why they're doing it. And so it's just been a very valuable experience.